Hi, my name is Harper, and this is my video for Kinesiology 220, how to properly bandage a wound. So I come up on a scene, if I'm, say, a first responder or something like that, and I see a victim, and so I assess the wound, make sure I know that I can deal with it and that I'm qualified for it. So then I ask, sir, is it okay if I help you out here? I'm first aid certified.
Yes.
Alright, so then what you want to do next is put on your gloves. I've already put my gloves on for the sake of this video. But you want to put your gloves on to prevent disease transmission because I don't know the victim doesn't know me, so this just protects us both. So then I want to apply a gauze pad as my dressing. Now the gauze pad will go right here on the elbow, or on the crease of the elbow. And this, I'm going to apply some light pressure. And this just kind of helps stop the bleeding, helps the bleeding to clot. If he were to bleed through this gauze pad, I would put another one on because you don't want to take a gauze pad off because you remove the clotting that the blood has been doing. So I want to apply a gauze roller as the bandage for this. So sir, could you please hold this for me for a second? So then I take my gauze roller and I wrap it once around the elbow, securing the gauze pad in place. And then I want to go above the elbow, wrap it around like so, and then go below the elbow and do the exact same thing. So you just want to repeat that over and over again. And this method is called the figure 8 method, and it is used for elbows or joints, knees and ankles, because joints like to move, so this just prevents them or allows them to move and not keep them straight like you would with a forearm, and so this just caters to the joint a little more. And so then when you're finishing up the gauze roller, you want to wrap it twice, 2 straight turns, at least 2 straight turns, and this just secures the bandage once more. And so then once you finish wrapping it, you want to tuck the bandage in to, again, secure it. Now the whole time you're doing this, you want to make sure that you're not wrapping it too tight or too loose. So sir, is that too tight or too loose?
It's fine.
So now that your bandage is wrapped properly, you don't want it too tight because you don't want to cut off circulation, and you don't want it too loose because you don't want it to fall off. If he were to continue bleeding or was experiencing a lot of other side effects, you would want to seek advanced medical care. So once you are done helping the victim, you want to properly dispose of your gloves. So you want to be sure that you do not touch the outside of your glove because that's the contaminated part. You just want to only touch the inside, like so, and then properly dispose of them. Thank you.